Welcome to Sunshine Science. Our mission is to alert the public on the dangers of insufficient sun exposure to your health. America's second largest public health problem is insufficient sun exposure. It's responsible for 340,000 preventable deaths per year. Adequate sunshine should be incorporated into daily routines in order to become healthier and increase life expectancy. That's why the Sunshine Health Foundation is committed to alleviating this severe health problem. Our world-renowned scientists provide public health officials with research on the benefits and risks of sun exposure. If you're ready to build healthier communities, then let's get started.
Is lack of sun exposure a determinant of your health? Well, according to increasing evidence, the answer is yes. And what exactly is a determinant of health? Well, determinants of health are the behavioral, social, and environmental factors that influence our health status. They include things like living wages, access to quality education, access to healthy food, exposure to crime and violence, poverty, weather, transportation options, exposure to toxic substances, substandard housing are all examples of determinants of health. And recently, more and more people are acknowledging that racism and discrimination are also significant determinants of our health. These factors, plus many more when taken together, are what determine individual and population level health. In fact, did you know that only 10 to 20% of your individual health is actually determined by health or medical care? The other 80 to 90% is determined by, you guessed it, the social, environmental, and behavioral determinants of health. And increasing evidence confirms that sunshine, specifically sensible sun exposure, is indeed a determinant of health. And sun exposure might actually play a role in reducing health disparities. In this episode of Sunshine Science, we'll explore why sun exposure is a determinant of health. And along the way, we'll discuss the important role that sun exposure plays in preventing or improving many health conditions, including depression, cancer, and diabetes. Now, we've all heard the warnings. Sun exposure causes skin cancer, sunburn, premature aging. But did you know that these warnings are mostly for white Americans? According to the American Cancer Society, melanoma, the most serious type of skin cancer, is more than 20 times more common in white Americans than in Black Americans. While sun exposure has been used as therapy throughout history and across cultures, for the past 50 years, scientists have discouraged sun exposure, primarily due to potential skin cancer risks for people with white skin. And those messages have worked, causing widespread paranoia about sun exposure and fear of developing skin cancer in white and Black Americans alike. And yes, we all want to avoid cancer. But as one scientist put it, just as vegetation is dependent on the sun's rays for sustenance, sunlight is also a major determinant of human health. So why is that? What makes sunshine a behavioral, environmental, and social determinant of health? Well, I'm glad you asked. First, let's explore sunshine through the lens of the behavioral determinants. Sun exposure is a known behavioral determinant of health. Behavioral determinants are all about the choices people make in their lives that impact their health status. So smoking, sexual activity, exercise, eating practices, and sun exposure are all behavioral determinants of health. And our behavioral choices are impacted by a wide variety of things: our social environment, our friends, our families, and public health guidance. Do you remember that time that Nigella Lawson, famed chef, went to the beach in Australia in a full cover, all Black, head to toe swimsuit? The media called it a burkini. And when asked about why she wore it, she said she made the choice to avoid the sun. That's an example of a behavioral determinant of health in action. Public health guidance for the past few decades has encouraged Americans to avoid the sun to avoid skin cancer, and has applied this guidance universally to Black Americans as well as white Americans. So it's not surprising to see people of all races covered fully when out in the sun or slathered in sunscreen. But along the way, we've also seen an increase in vitamin D insufficiency in 70% of the US population. And that's been linked primarily to sun avoidance. And while it's 70% in the entire US population, that breaks down to 62% of the white population and 95% of the Black population. Among Black Americans, vitamin D insufficiency has been called the hidden epidemic. And scientific discoveries over the past 20 years show that low levels of vitamin D are in some part to blame for racial health disparities, including higher rates of hypertension and heart disease. When it comes to the behavioral determinants of health, study after study show that daily sun exposure is critically important to our health. In fact, it's been shown that insufficient sun exposure may be responsible for up to 340,000 premature deaths in the United States and can be linked to an increased incidence of breast cancer, colorectal cancer, hypertension, cardiovascular disease, metabolic syndrome, Alzheimer's disease, asthma, and autism. So our behavior, our choice to enjoy the sun in a safe way for a few minutes each day can have an impact on our health in profound ways, making sun exposure a behavioral determinant of health. Sunshine is an environmental determinant of health too. Environmental determinants are things like air quality, exposure to extreme weather conditions, access to clean water, those things in our external environment that influence our health and health outcomes. And evidence suggests that sensible sun exposure should be added to that list because where we live, the natural environment around us, weather conditions, and our exposure to the sun impacts our health. Living in areas below a latitude similar to that of Los Angeles and Atlanta for the first 10 years of life reduces the risk of developing multiple sclerosis by more than 50%. 50%. A recent study also found that those who were born and live near the equator are 15 times less likely to develop type 1 diabetes when compared to people living in more northern or southern latitudes. And interestingly, it's been found that sunnier areas are associated with fewer deaths from COVID-19. There's even research showing that optimized vitamin D levels are more effective than a flu shot in preventing viral infections. Yep, but you can't get these benefits from vitamin D pills. Sunshine is an environmental determinant of health because our exposure to the sun is necessarily impacted by the natural and built environments where we live, learn, work, play, worship, and age. And finally, sun exposure is also a social determinant of health because our exposure to sun is influenced by the conditions of our social environment. According to the Department of Health and Human Services, social determinants of health include things like safe housing, transportation, safe neighborhoods, our social conditions. And one of the key reasons why sun exposure can be considered a social determinant of health is because our social environments of today are primarily indoors. We've seen an increase in the amount of time we spend on computers. We spend long hours in an office building or working from home. We spend our leisure time indoors. We actually place more of an emphasis today on scheduled activities rather than free play. Far too many of our communities have limited, if any, available green space. And neighborhoods today are being developed with no sidewalks. These are just a few of the reasons that we're spending less time outdoors. And by not being outside, we're missing opportunities to get the health benefits of sensible sun exposure. And our bodies need the sun. We need the sun to make vitamin D, which plays a crucial role in so many body processes from bone development to our immune system. And vitamin D is not the only health benefit we get from the sun. Sun exposure aids in healthy sleep and improving our mood. The reality is the strongest evidence for the role of sunlight as a social determinant of health comes from its impact on our mood and our quality of life. Sun exposure helps our brain release the feel-good chemical known as serotonin. Higher levels of serotonin correlate with a better mood, with feelings of satisfaction and calmness. And lower levels of serotonin are linked to depression and anxiety. So sunshine is a social determinant of health because sun exposure, like all social determinants, impacts our overall wellness and quality of life. Now, I want to be clear here. Too much sun exposure can increase our risk of skin cancer. And you're getting too much sun exposure if your skin gets red or burned. But as we've learned in this episode of Sunshine Science, like all determinants of health, sun exposure impacts our quality of life and affects a wide range of health concerns. And modern science shows us the importance of everyday sensible sun exposure for our health. By now, you're probably saying, yes, Montrese, I believe sun exposure is good for me, but how much sun do I need? Well, you need enough sun to get your vitamin D level up to 30 nanograms per milliliter. And that's on the standard vitamin D blood test. 95% of Black Americans currently have less than this. And everyone's needs vary. The lighter your skin is, the less sun exposure you need. And because of the magic of melanin, the darker your skin is, the more sun exposure you need. So, sun exposure is a behavioral, environmental, and social determinant of health. And with winter just around the corner, we'll see fewer hours of sunlight. We'll probably spend even more time indoors. And many of us will suffer from the wintertime blues. This makes getting intentional about sun exposure even more critical. I hope this episode of Sunshine Science inspires you to do so in a smart, safe way. And my hope is that this episode inspires change in the conversation around sun exposure, its potential impact on racial health disparities, and its role as a behavioral, environmental, and social determinant of health.
Thank you for listening to today's episode. If you're ready to build healthier communities, please visit sunshinehealthfoundation.org to find the latest research on the health benefits and risks of sun exposure. Or you can subscribe to our newsletter for our latest updates. Step out of the dark and embrace sunshine. Let's build healthier communities.